If I have chronic inflammation, do I have to cut out gluten or should I cut out gluten? I'm Dr. Monica Agrawal. I'm a preventive cardiologist. It's a good question, but the answer is yes or no. So remember that 2 or 3% of the population has celiac disease, which is gluten allergy, whereas about 7% of the population has a gluten sensitivity. So that means that 93% of the population doesn't have a problem with gluten. And so what I typically tell people to do is listen to your body. If you feel that when you eat gluten-rich foods, that you have more inflammation or your joints hurt more, or you just don't feel as good, then don't eat it. Then maybe you do need to do some sort of gluten restriction. Typically, I eat gluten and I eat gluten-rich foods, but I don't react to them. But there are many people who feel like they do, and if they do, then restrict it. And I think that's the best way to handle it. But to remember that 93% of the population probably doesn't have to restrict gluten. And when we eat a lot of gluten-rich foods, remember to make the food tasty or soft, often a lot of sugars and oils are added. So it's sort of a risk-benefit ratio.